Masturbation. After 50, benefits and risks you should consider. If you're a man over 50 and you still masturbate, I need you to listen closely because what I'm about to tell you is something almost no one in America explains honestly or directly. The way you touch your body in private could be impacting your health far more than you realize, and not always in a positive way. Maybe you've done it quietly for years, with a bit of shame, doubt, or even fear, wondering if it's still safe at your age, or if you could be harming your body without knowing it. The truth is that after 50, every habit involving your body matters more than ever. Your hormones start to shift, blood circulation slows down, sensitivity changes, and your sexual response evolves. Think of your body like a car engine. When you were young, you could rev it up without a second thought. The oil was clean, the parts were new, and everything ran smoothly. But after 50, that engine needs maintenance, care, and regular checkups to keep performing well. Ignoring these changes can lead you to misunderstand what's actually healthy and what isn't. At this stage, masturbation is not simply good or bad, it's a tool. And like any tool, it can help you or hurt you, depending on how you use it. When practiced with awareness, respect for your body, and moderation, it can be a powerful ally for your health. But when done compulsively, mechanically, or without knowledge, it can open the door to physical issues, emotional strain, and even problems in your relationship. And this isn't just opinion, there's science behind it. A study published in the Journal of Sexual Medicine followed over 3,000 men between 50 and 80 and found that those who maintained regular sexual activity, including masturbation, had better erectile function, fewer prostate problems, and stronger emotional well-being. Another Harvard study with more than 3,200 men over an 18-year period found that regular ejaculation was linked to a lower risk of prostate cancer. But here's the key. It's not just about how often you do it, it's about the quality of how you do it. A rushed, mechanical release doesn't offer the same benefits as a mindful, intentional moment of connection with your body. In my practice as Dr. Daniela Ramirez, a urologist specializing in men's sexual health, I've seen both sides: men who regained their vitality with conscious habits, and others who, due to misinformation, developed erectile dysfunction, pelvic pain, or emotional dependence. I remember a patient, Richard, 62, who came to me frustrated because he could no longer get or maintain an erection with his partner. After evaluating him, we discovered he had conditioned his brain to respond only to one very specific type of stimulation he used alone for years. With a few simple habit adjustments and proper sexual education, he regained his confidence and improved his relationship. That's exactly why I'm talking to you today. I'm going to share the 10 proven benefits of masturbation after 50, but also the 10 potential risks you need to know, so this habit becomes an ally, not an obstacle, to your health. This won't be a moral lecture or a taboo talk, just honest, clear, science-based information you deserve. And most importantly, I want you to understand that your sexual health is part of your overall health, just as important as your heart, blood pressure, or glucose levels. What you're about to learn may surprise you and completely change the way you view a topic nobody ever explains in detail. So let's start with the good news. Benefits backed by science. Benefit number 1. It supports penile health. Every erection acts like a vascular workout for your penis, increasing blood flow to keep the tissue elastic and strong, like inflating a balloon regularly so it doesn't stiffen and lose flexibility. One of my patients, Albert, 67, came to me concerned because his erections were getting weaker, and with mindful practice plus improvements in his diet and exercise, he regained firmness, sensitivity, and confidence. Benefit number 2. It promotes prostate health. Multiple studies, including the well-known Harvard research, show that regular ejaculation can help reduce the risk of prostate cancer because it helps flush out the prostate ducts, clearing out inflammatory or potentially harmful substances that can build up over time. Think of it as internal maintenance, that keeps everything clean and functioning smoothly. Benefit number 3. It strengthens your pelvic floor, a benefit most men don't even realize they're getting. During orgasm, the muscles that support your bladder, rectum, and sexual function contract powerfully, and when masturbation is practiced with control and awareness, it becomes a natural form of exercise that increases strength, stamina, and sexual performance, reducing the risk of urinary leaks and improving erection quality. Benefit number 4. It reduces cortisol, the stress hormone that affects your mood, blood pressure, and even your immune system. An orgasm acts like a pressure release valve for your mind and body, helping you calm down, release tension, and reset emotionally after a long day. Benefit number 5. It triggers the release of feel-good chemicals like dopamine, oxytocin, and prolactin, which are responsible for pleasure, bonding, and relaxation. These neurochemicals can elevate your mood, help reduce anxiety, and even strengthen emotional connection with a partner when masturbation is paired with self-awareness instead of guilt or secrecy. Benefit number 6. It improves self-awareness and early detection. When you're familiar with your own body, you're more likely to catch changes in your testicles, penis, or skin early, changes that could signal something serious like testicular cancer, Peyronie's disease, or infections that need medical attention. Knowing your body is a form of prevention. Benefit number 7. It improves sleep quality. The mix of oxytocin, prolactin, and lowered cortisol levels after orgasm creates a natural sedative effect that helps you fall asleep faster, stay asleep longer, and wake up more rested. Benefit number 8. It boosts pelvic blood circulation, keeping the entire genital and prostate area well oxygenated and healthy. Good circulation helps prevent inflammation, pain, and tissue deterioration, crucial as you age. Benefit number 9. It trains your ejaculation control, making it a powerful tool for men dealing with premature ejaculation. Practicing techniques like the stop-start method or the gentle squeeze technique can retrain your brain and body to last longer without the pressure of performance with a partner. Benefit number 10. It keeps your sexual brain circuits active, maintaining libido and preventing your desire from fading with age. It's like keeping the spark plugs of your sexuality firing so your body doesn't forget how to respond to sexual stimulation. But now that we've covered the science-backed advantages, it's just as important to talk about the other side of the coin, the risks. If you're not informed, what could be a healthy habit can turn into a problem that affects your physical, emotional, and even relational well-being. Risk number 1. Social isolation. When masturbation becomes a replacement for human intimacy, connection, and bonding. If you begin to choose solo release over shared intimacy, it can slowly disconnect you from relationships and real emotional connection. Risk number 2. Skin irritation or microtears from excessive friction or lack of lubrication, which can lead to inflammation, sensitivity, and even infections. Risk number 3. Pleasure desensitization. When your brain becomes conditioned to only one very specific type of stimulation, making it difficult to feel aroused or satisfied with a partner. Risk number 4. Masking erectile dysfunction. Some men can get an erection alone, but not with their partner, which can hide underlying issues like poor blood flow, hormonal imbalance, or cardiovascular disease that require medical evaluation. Risk number 5. Nerve compression and pelvic tension from masturbating in awkward positions or for too long, causing numbness, pelvic pain, or discomfort in the lower back and pelvic nerves. Risk number 6. Emotional dependency. Using masturbation as your only outlet to deal with stress, loneliness, or frustration can turn it into a coping mechanism rather than a healthy practice, affecting your emotional resilience. Risk number 7. Guilt and shame rooted in old cultural or religious beliefs, which can harm your self-esteem and mental health, creating conflict and emotional distress around a natural human behavior. Risk number 8. Pelvic congestion from excessive frequency leading to testicular discomfort, heaviness, or inflammation. Risk number 9. Impact on semen quality, especially important for men who still want to father children, since over-ejaculation can reduce sperm concentration. Risk number 10. Detachment from reality. When masturbation becomes tied exclusively to extreme pornography, distorting your perception of sex, bodies, and intimacy, and making real connection less satisfying or even anxiety-provoking. As I always remind my patients in my practice as Dr. Daniela Ramirez, your sexual health is part of your overall health, just as important as your heart, blood pressure, or mental well-being. Caring for it shows self-respect, maturity, and responsibility. Practiced with balance, awareness, and respect for your body, masturbation can help you feel more confident, energized, and deeply connected to your masculinity. You are not alone. Thousands of men I've worked with have proven that with the right information and small habit shifts, you can maintain a fulfilling, healthy, and satisfying sex life well into your 50s, 60s, 70s, and beyond. Stay informed, stay mindful, and treat your body with intention, and you'll see how this simple habit can become a powerful ally for your overall well-being. If this message helped you, share it, leave a comment, and don't forget to subscribe so we can continue learning together. I'll see you in the next video.